Hi, my name is Thomas Tsai. I'm a PGI3 internal medicine resident at Metro West Medical Center in Framingham, Massachusetts. This project is called EMPOWER-CKM, a resident-led, multilingual educational web app designed to support cardio-kidney-metabolic health education in everyday clinical practice. Cardio-kidney-metabolic, or CKM health, describes how heart disease, kidney disease, and metabolic disease such as diabetes and obesity function as one interconnected system. In practice, CKM is difficult to explain, time-intensive to teach, and disproportionately affects patients with language barriers and limited health literacy. In our resident continuity clinic, the loss of dedicated diabetes education resources has placed this responsibility almost entirely on residents, often within 15-minute visits and across multiple languages. EMPOWER-CKM addresses this gap by giving residents a point-of-care educational tool that patients can use during or after a visit without increasing cognitive load for the clinician. It delivers evidence-based CKM education through clear visuals, plain language, and interactive modules, currently available in English, Spanish, and Brazilian Portuguese. The app is organized as a guided learning path, not a static handout. Patients start with what is CKM health, and then progress through modules on diet, physical activity, understanding lab numbers, and treatment options, mirroring how clinicians actually counsel patients in clinic. For example, in Your Plate and Your Health, nutrition counseling is anchored to the plate method, sodium awareness, and food label literacy. Patients can interact with a nutrition label to see why sodium acts as a water magnet, raising blood pressure and straining the kidneys, linking everyday food choices to organ-level effects. In understanding your numbers, patients explore blood pressure, HbA1c, lipids, weight, and kidney markers through a single simple dashboard. The emphasis is on early, reversible disease, helping patients see prevention as something they can actively influence. From a technical standpoint, this project is intentionally non-commercial, low-cost, and designed for feasibility in frontline care. Traditionally, building a multilingual, interactive patient education platform like this would require dozens to hundreds of hours of coordinated development, time and resources that busy medical residents simply do not have. By using an AI agent-enabled, integrated development environment such as Google Anti-Gravity, we were able to dramatically accelerate both the pace and quality of development, compressing what normally would have been a large, collaborative engineering effort into a rapid, clinician-driven, and clinical feedback-driven build, with no additional budget, no dedicated developer, and no external vendor support. EMPOWER-CKM directly addresses healthcare disparities by reducing linguistic and cognitive barriers to preventive care. The app will be field tested in early 2026, with resident usability and patient engagement measures built into the quality improvement framework. EMPOWER-CKM demonstrates how frontline clinicians can translate clinical insight into scalable, practical tools that improve healthcare delivery. Thank you.